and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Hi everyone, I'm Alex, physical therapist assistant,
I'm Mike, physical therapist assistant.
and this is the Total Hip Replacement Fitness Program. Hip precautions and how to follow them. Very important one here.
Note,
Note,
your surgeon will give you specifics or precautions that you are supposed to follow. Follow those. It might not be what we recommend here. You can check with your surgeon if these are what you want, depending upon what approach you have.
Yep.
And typically, you'll follow them for 6 to 8 weeks. It varies. Ask your surgeon. Maybe they want it longer. So just
Yep.
go by what they say. This is just kind of recommendations and basic overview.
yep. So the two primary approaches is posterior approach. It just, where they go into your hip is what they're talking about here. That's the most common. Posterior approach, number one, no bending, or we call it hip flexion past 90 degrees. So Mike's
So
going to
if
show
I'm
you.
bending,
So
here's
right
about
now,
90 degrees. If you look at the angle
nothing
of
past there.
you don't want to go past down to here,
Yep.
but you can also get past 90 degrees if you lift your leg too high.
Yep.
So you have to think about it both ways. There's
Yep.
not just one way to get 90. This is past 90. This is past 90.
Yep. And I'm sitting here. If I reach forward to pick something up, I'm past 90. So
You got to think when you're sitting and
Standing,
standing.
yep.
I mean, laying down a little bit. But
yep, probably not real off.
The next thing, don't do what I'm doing right now.
Yep. Don't cross your legs.
No crossing your legs. They don't want you to cross them this way or even just crossing your midline. They don't want this either down
Yep.
at your ankles. These are no-nos early on. They do not want you to have a dislocation.
Yep.
So
And you don't want to do a lot of twisting, or they call it internal rotation, is what I'm doing with my leg here, kind of turning it in.
yep, and you can twist in a seated position, but you don't always think about it. You can also, if you're walking and you're turning,
Yep.
I'm twisting my hip right now.
Yep.
So make sure to always walk normal and don't like twist and cause a force.
Yep. Take small steps is always a key we give. So
Yep.
we're going to get into that, how to avoid breaking precautions. Now, the second anterior approach, a little less common, but we've seen it quite often.
Yep, anterior just meaning front. They go in front of the front versus the back.
Yep. No extension. So extension is bringing your leg backwards. So like walking backwards. You don't want to ever take any steps backwards because that would be extension.
Nope. I mean, most people probably won't extend too much.
No.
You also don't want to if you're reaching down, you're kind of extending.
Yep. You don't want to kick your leg back.
So
Yep.
don't do that. Again, the same thing. Like basically no crossing your legs.
Yep.
The-
External rotation. This is external rotation, is having your leg roll out the other way.
Yep.
or-
if I'm crossing my legs, I'm externally rotating my hip.
Yep.
Also, probably recommended no crossing your midline again.
Yep. Just, this is kind of scientific here, but just keep your leg in neutral. And I think it's worthwhile saying, Mike, we've both worked as PTAs for 10 years. I've never heard of somebody dislocating their hip. Have you?
Well, I've heard of it, yeah.
Well, personally, what a patient you've had. Have you had a patient
I've had a
dislocate?
patient we've seen after they dislocated
Okay,
it.
so you have heard of it, but rare,
Yes.
very rare, right?
It usually takes a force with a movement.
Right.
It's usually not just, oops, I accidentally crossed my legs, my hip popped out. It's normally not that easy.
Yeah.
It's normally a hard, they twist.
Yeah.
And they're doing, it normally takes 2 motions combined to dislocate
Something
it
traumatic, yeah.
with some type of force.
Sure.
So it's not super common, but it does happen.
Yep.
Not trying to scare you off, but just follow your precautions and you'll be fine.
Yep. Now, the second part, we're going to get into how to avoid breaking your precautions. Functional things, how to avoid breaking your precautions. Number one, this is a biggie. You do it every day. getting dressed. The key is to use adaptive equipment like we have here.
Yep.
So
Kind of do a quick demo of each thing. So a basic reacher, you know what a reacher is. Pick something up off the ground.
Yep.
If I were to drop these pants like this, try to bend over, I'm breaking
you're
precaution.
breaking 90 degrees.
So
Yep.
you have a reacher, you just pick it up with the reacher.
Pick them up. And then when you want to put the pants on, leads us to the next thing here.
Yep, so I'll take my shoes off quick.
And these things, this is going to take you some time, you know,
Yep.
to figure all this out. If you have a spouse that needs to kind of watch you or help you out.
So
you know.
it doesn't really matter. I'll just say my left side's my non-surgical side. Then I'll put my right side in.
So you want to pull it up on your surgical side first. So Mike's going to act like which side's surgical?
Well, I guess we'll say my left is surgical.
Left
for now.
side, so.
So I'm going to pull it. What kind of reacher you got here?
Well, it's been used before.
Yeah, basically, as you can see, this takes a lot of practice.
It does, and it's not, I'm glad that you're kind of struggling with it because it's not easy to do, so.
How many thousands of people know I can't put on pants? There we go.
All right, so we're going to act like Mike has the pants on already. You know what, just takes time. It's going to take you 5
You
minutes.
can just talk through the next thing. I'm going to get these on.
But then, you know, when Mike's going to take the pants off, he's going to undress his surgical side last. So he's going to undress his left leg last
Ha-ha.
to not break the precaution.
So I'm going to adjust this side. So I just pull
Yep.
back down, and then, you don't want to bend too far, so I'd stop here. You can use the top of the reacher.
Yep,
Just
so
kind of push down.
get your good leg out first.
Oh, my good leg out
Your
first.
good leg out first.
I'm learning something today.
Yeah, you are. This is kind of occupational therapy. We're out of our realm here.
We are.
All right, so that's pants on and off. I'm going to kind of demonstrate getting your shoes with a long-handled shoehorn. So we're going to pretend I have elastic shoelaces because tying the shoelaces, that's another problem. You can't reach forward to tie your shoelaces.
You can be like me and does not have shoelaces.
Or that works too. Slippers, we see that a lot. So the long-handled shoehorn, stand up straight. Don't bend forward to break your precautions.
Slide out. Just fix it in there.
Look at that. I
Puts
got it on
You
without
can
bending
also
forward.
take them off with that.
Oh yeah, you can push them right off.
They're very handy to use. They're very reasonable, cheap. We'll link these basic products down below if you want to buy one. Your surgeon might supply some for you, so ask them. You don't have to buy them.
Yep.
But next thing is a sock aid.
Sock. Oh, that's right.
You
We're gonna
forgot
do
the
the sock
sock
aid.
aid.
Yeah.
So this is a sock aid. What you do is you put your sock on. You might have to get socks that are, if you wear real small, tight socks, kind of like I do, you might have to get a little bit bigger ones temporarily.
Yep.
So you just fish it on here. You want to get it on all the way. So I'm feeding it on. Okay.
And you want to make sure the string on the sock aid is long enough so you don't have to bend forward, at all, because you'd be breaking your 90 if you bent forward at all.
Kind of weird. So what you want to do is keep your leg down here. Pull it up. Oh, this socket is too small for my feet.
Yep, they come in different sizes.
Make
so.
sure you get a big enough socket for
But
your leg.
he's going to make it work.
I'm going to slowly.
Muscles.
So I got it partly on. If I had a thicker one, a bigger one is just going to be wider this way, basically. It's just too narrow for my feet. Then what you do is you go over to
Yep.
your reacher and just keep digging around. And then if you
Pull it on.
fast forward about 10 minutes, you will see me get it all the way on.
So, it's going to take you some time.
What a reacher. I'm
Moving,
telling ya.
we need a better reacher. All right, moving on. Number 2 is standing up and sitting down. You do this many times a day. You don't think about it, but you have to avoid those low seats. And we have a chair here.
I'm breaking precautions right now. Don't mind me.
All right, throw Mike's pants off there. Now, this seat is kind of questionable. I'm going to take a seat here. And I would say I'm
You're a little below 90. It's hard to
think
tell.
I'm a little below
So
90.
if you look at his hip here, and then you look at his knee here, he's actually descending slightly.
Yeah.
I mean, if you happen to get in a situation like this, the likelihood of your hip dislocating is not very
Yep.
high.
Yep.
But it's just something to be aware of because your seats or recliners at your home might be more severe than this.
Those rockers and those soft sofas that you kind of sink right in.
Yep.
Do not sit in those for
This
the first
is-
while.
We would not ever recommend this, but this is an extreme case. You see how much higher my knee is than my hip? This is way beyond 90 degrees of bending.
Yep.
So obviously you're not going to sit on something this low, but this is just to show you, the lower you sit, your butt compared to your knee, the more you're bending.
That might be a dislocation right there.
Yeah, that would be possible.
And you want to use chairs with armrests,
Yep.
so you can slowly descend because your hip is not going to want to take all that pressure, early on. And then to get up, slide to the edge of your seat first without breaking your precautions. You might have to be kind of bending
the
forward.
chair's still there. You can show
I
'em.
suppose I could do that.
Jeez.
Mike's always so technical. So slide forward, but don't bend forward when you slide forward.
Try
And
to
then
keep a
sit to
neutral
the edge
spine and go
and
up.
stand up. So
That's how you get up from a chair, and do not sit too low. Next is bathing and toileting. For bathing, you might have to use a long-handled sponge. We don't have one here. I'll put a picture.
let's pretend this is one.
Okay, he'll pretend. I'll show a picture of one too. But
To wash your back.
you can wash your back. You can wash your legs. You don't want to, people, if they wash their legs, I'd typically bend over.
Yeah.
And be breaking precautions. Use the sponge. If you have a shower head that you can grab and just spray, like you can do that. Just don't bend down.
Yep.
But those are things to think about.
Please do not sit in the bathtub.
Yeah, if you have a normal low bathtub, jacuzzi tub, do not sit in it right now. If you have a taller shower bench, that is probably fine. Just
Yep.
make sure you're not bending beyond 90 degrees.
Yep.
I don't think most people, if they have a hip precaution or hips replacement, would want to sit in the bathtub. You can't actually
No,
take baths
no.
for quite a while.
No. And then toileting, going to the bathroom, a raised toilet or even a commode with armrests over the toilet would be nice.
Yep, they sell different versions. They sell one that just goes right on the toilet seat with handles. They also sell like a commode, which is an open bottom,
Yep.
and then you can sit on that. Or if you feel like your bathroom's too far away, you can get a commode that's basically a porta potty you can
Yep.
clean out.
And they're probably going to set you up with a lot of this equipment they think you're going to need, and and give you some advice on what you personally will need. So,
Yeah.
all right, and then number 4, steps. When you're ascending steps, you always go up with the good leg first, and down with the bad leg last. That way the
So first I'll say my left one's bad.
Yep.
Steps, you're going to go up with your good one.
good leg. Because you notice the bad leg, all it's doing is staying straight, and then when Mike goes down, he's going to go down with the bad leg first. It stays straight again, and
Yep.
this one's doing bending. So,
So this leg is doing all the work.
yep.
So yeah, he just takes all the pressure off and don't have to worry about breaking any precautions.
Eventually, you'll get back to doing it the normal way, but
Don't go backwards on a step.
no, don't do that, especially with an anterior approach. All right, sleeping, avoid sleeping on your surgical side.
Try to sleep on your other side or on your back.
I'll get in the chair.
Do
you
not
can lay
sleep
down.
on your stomach. Let me get those pillows,
I would love to.
please, sir. How about the other ones for my legs? So we're gonna say my left side is the surgical side still. So if you're sleeping on your right side, it's probably fine. You're more than likely gonna want to have a pillow in between.
Yep.
If they're close together, you're not past midline.
Yep.
But it's not as comfortable. Obviously, you don't want to, if you sleep like this, that's a no-no.
I'd rather be safe than sorry. I would
Yep.
definitely throw the pillow
So
in
you
there.
could throw a pillow in here.
Or they make these things called abductor wedges or
Yep.
pillows.
Your surgeon would more than likely send them home
Yep.
with you if they want you to have one. It actually straps your legs in. We'll put a picture of one up just so you can see what it
Sure.
looks like. They're a little more, they're not a restraint, but they typically
Yep.
have straps on them as well.
Yep.
Just to keep you, if you're a night turner, like you twist and turn a lot and you don't know because you're sleeping, they might be safe to wear early on.
Yep.
And then you can get rid of them. But a pillow, is a fine option as
Yep.
well.
And then number 6, I'll hand it to you since you're already on the mat.
Oh.
Getting in and out of bed. So,
So my left leg again. All you do is use a leg lifter. These are very cheap and reasonable. I just get some support, scoot to the edge, and using my hands to...
this way Mike can keep his hip in neutral. It's not doing the internal, external rotation
Yeah,
as he's
'cause
coming out of bed.
If I were normally to get out of bed, on my own, I'm rotating and doing all
Yeah.
sorts of things. I mean, I move quicker than
Yeah.
a person probably getting a hip replacement.
Yep.
But you want to be slow and controlled, getting in and out of bed. Slowly lifting my leg up. Your other good leg can do whatever it wants. Getting situated. So my leg's staying pretty straight this whole time I'm doing this. I'm not-
Everything's about neutral. Everything we're doing here, neutral is the word.
Yeah,
So,
you don't even. Some people like to sit up first. Like here, you're at 90 degrees already.
Yep.
So kind of think about, getting this leg here and then kind of working your body up.
is this an ab workout or a hip replacement?
I don't
program?
know.
Boy,
Which
you're-
one is
you're
it?
throwing yourself around. And I think number 7, I didn't have this one on the board, but I think it's worth mentioning again. Walking. Imagine I have a walker, and I'm going to take a turn here. Instead of turning my leg like this, I'm just going to take small steps to kind of keep my leg in neutral. Or if I'm going to turn this way, I'm not turning like this. Take those small steps. Don't break your precautions because
And your steps are going to have to be shortened too if you have an anterior approach.
Yep,
You're going to have
that's
to
right.
walk a little differently. They'll teach you that. Your therapist or doctor will tell you that beforehand. But yeah, your walking pattern will probably be different for a while until you're past the precautionary stage. So
boy, I feel like we were all over the place there. Look at this mess we made.
we were. Who's going to clean it up?
I don't know.
You can check out more episodes related to Total Hip Replacement Fitness Program on YouTube or bobandbrad.com/programs.
Thank you.
Thanks.